Alright, so we're chugging along on pharmacy topics. In today's video, we're going to be answering questions on pH imbalances and body fluids. These questions should provide good practice for studying for pharmacy school exams or the MAPLIX exam. Alright, so let's dive into it. Question number one. Question number one says, the arterial blood gas, ABG, readings for a patient are as follows: 7.31, 48, 70, 30, 91. Which of the following is a correct diagnosis for this patient? This question seems pretty straightforward, but it could be tricky because you're given the ABG numbers for this patient, but you have to remember what each number stands for, which means that you have to know the order in which the different terms are given. And sometimes you can guess what each number stands for by looking at the value of the number, because each physiological term comes in a certain range of numbers, right? For example, pH, is going to be somewhere around 7. So automatically when you look at the numbers, you see 7.31, that must be the pH. Now, what about the number 48? What does that stand for? That will correspond to the partial pressure of carbon dioxide in the blood. The normal range for the partial pressure of carbon dioxide in the blood is 35 to 45 millimeters of mercury. So since this is 48, that's a higher level of carbon dioxide. So after the carbon dioxide, you're given the partial pressure of oxygen in the blood. And in this case, it's 70. So this is on the low end. So there's low oxygen and high CO2 for this patient. And then after giving the partial pressure for oxygen in the blood, you're going to be given the concentration of bicarbonate ion in the blood. That's what the 30 is going to stand for. In this case, it's 30, which means that the level of bicarbonate ions in the blood is higher than usual. And lastly, 91, numbers in the 90s will correspond to oxygen saturation of the blood. And we would like that number to be above 95. But for this patient it's 91, which means that oxygen saturation is lower than normal. Okay, and that's how you would interpret all these numbers for the ABG. Given these numbers, what can we conclude about the status of the patient? We know that 7.31, that's a low pH because normal pH ranges between 7.35 and 7.45. So the blood of this patient is acidic. So this is definitely going to be a case of acidosis. And we have to choose between answer choices A and D. Answer choice A says respiratory acidosis, and answer choice D says metabolic acidosis. So which one is correct? You want to look at the CO2 versus the bicarbonate ion levels. If the CO2 level corresponds with the pH level, then it's going to be respiratory acidosis. However, if the bicarbonate level corresponds to the pH level, then it's going to be metabolic acidosis. Now, we already see that we have a high level of CO2 in the blood. It's 48, and CO2 would cause the blood to be more acidic than usual, which means that the CO2 level corresponds with the pH level. So this is going to be respiratory acidosis. The bicarbonate ion level is higher than usual. That would make the blood more basic than usual. That does not correspond with the pH of this patient because the patient has low pH, not high pH. So the high bicarb level is due to compensation to make up for the acidity caused by the CO2 in the blood. This is going to be respiratory acidosis. And the correct answer is going to be answer choice A. And that's how you answer this question. All right, so let's move on to question number 2. Question number 2 says, which of the following conditions is most likely responsible for the diagnosis in the previous question? So in the previous question, we diagnosed the patient with respiratory acidosis. And in this question, we're looking for a logical reason that can explain acidosis in such a patient. When it comes to respiratory acidosis, it has the word respiratory in there, which means that it's probably going to be due to a condition that impacts how the patient breathes, right? After all, we breathe in oxygen and we exhale CO2. Now, vomiting and diarrhea, that's going to eliminate bicarbonate levels and lead to metabolic acidosis, not respiratory acidosis. Now, answer choice B says hyperventilation. If your oxygen level is low, you're going to hyperventilate. But this is not going to be the right answer because here's the thing. Hyperventilation is not going to cause low oxygen and high CO2. Hyperventilation is going to help to correct that disorder, because hyperventilation is going to allow you to take in more oxygen and eliminate more CO2. So the patient in the last question might hyperventilate to correct their condition, but that's not going to be the cause of their acidosis. All right, answer choice C says diabetic ketoacidosis. Diabetes is due to the condition of not being able to utilize glucose in the blood, right? So this is going to be more of a metabolic issue, which means that this will cause metabolic acidosis, not respiratory acidosis. So this would be an incorrect answer as well. And now we're left with D, COPD exacerbation, which is definitely something that will hinder a patient's ability to take in oxygen and eliminate CO2. So this will definitely lead to higher CO2 levels and lower oxygen level. So this would be the correct answer. And of course, E was incorrect because we did make the diagnosis of acidosis for this patient. All right, now let's move on to question number 3. Question number 3 says, correctly match the diuretic classes in column A to their site of action in column B. Okay, so this question is about the diuretic classes. So we have loop diuretics, thiazide diuretics, and the potassium sparing diuretics. And you definitely want to know what part of the kidney nephron these drugs work on. Loop diuretics act at an earlier point, then the thiazide diuretic act at the middle point, and then lastly is the potassium sparing diuretic, which acts towards the end of the nephron. Now, out of these 3 sites, the first site is the thick ascending loop of Henle. So that's where the loop diuretics are going to act. They act on the thick ascending loop of Henle. And then the second site of action is the early distal convoluted tubule, and that's where the thiazide diuretics are going to act. And obviously the last answer choice is going to be for the potassium sparing diuretic, which is going to act at the late distal convoluted tubule. Towards the end of urine flow, the body exchanges potassium for sodium. The kidneys take back some sodium and give up some potassium. But potassium sparing diuretic prevent this from happening because they stop the exchange of sodium for potassium towards the end of urine flow. So that's where potassium sparing diuretics are going to act. And these would be the correct matches for all 3 diuretic classes. Okay, so there you have it. Hopefully that was helpful. For those of you who are studying for your exam, I wish you guys the best of luck. I went through this myself last year. It's not as bad as you think it is. Just definitely make sure that you understand concepts more so than memorize information. All right, you can't memorize everything, but you can understand a lot. If you can just wrap your mind around a few fundamental concepts, you can understand a wide range of information. So definitely focus on learning and understanding, and that's going to save you a ton of time in memorization. All right, so hopefully this video was helpful. If it was, go ahead and give it a like. If you're new to this channel, go ahead and subscribe. I encourage you to join our family here. We release videos at least twice a week on this channel, and hopefully as we continue to grow and expand our reach, we'll be able to post content on a daily basis. So definitely help us grow, spread the word, share our videos, and like, comment, and subscribe. With that said, I'll see you guys in the next one. All right, bye-bye.